So, good morning, everyone. I'm really happy to see so many people here. And so obviously there's a broad interest in the topic of today, which is best practices and new avenues for building research capacity in global health. This session, let me mention, is hosted by GLORA. So the German Alliance for Global Health Research, and it's an initiative to promote networking and strengthen global health research in Germany. We're proud to have more than 900 members. It was founded 2020, and this is the fourth session at the World Health Summit, indeed. So content-wise, we define research capacity to be the country's ability to produce, debate, use research knowledge and products relevant to their needs, such as new technologies. In the international development domain, research capacity obviously is a key concern. And research capacity obviously needs long-term and complex processes to be sustainable in the end. So the aim now of this workshop, and I'm really happy to have such a great panel together, is to discuss and learn from different approaches of research capacity building beyond short-term research projects and bring together the perspective of researchers, founders, and in the end, implementers. So welcome everyone. With this, I would also like to introduce firstly my co-chair, Professor Micek Czagunda. And Micek Czagunda has a doctorate of agricultural science with a degree in quantitative genetics. He's currently the chair of animal breeding and husbandry in the tropics and subtropics at the University of Hohenheim. His interests are in linkages and relationship among food systems, so focusing on livestock, sustainable livelihoods and health, environmental well-being. And finally, just a few words to myself. I'm an immunologist and infectious disease specialist. I'm a professor at the Technical University of Munich, and I work in neglected tropical diseases, their impacts on non-communicable diseases, especially allergies, co-infections, and vaccines. I'm also the co-founder of the Center for Global Health at the Technical University, which I co-direct. And with Micek together, I'm also a member of the steering committee of GLORA. Okay, with this, we're already done with the introduction. And I would like to now introduce our first speaker. Faith Osier. Professor Faith Osier is from the Imperial College, and she has a vision, and she will share this with you, is to make malaria history specifically, but there's also other visions that she has that she will share with us. She is chair in malaria immunology and vaccinology in the Faculty of Natural Sciences at Imperial College London. She's the co-director of the Institute of Infection. She is also the president of the International Union of Immunological Societies with more than 60,000 members worldwide, and actually the first African and only second woman in that role. And what I love specifically about Faith is her passion about promoting African scientists as key agents of change. And I'm sure, Faith, you will share within the next 5 minutes your vision here. Thank you very much.
Thanks very much, Clarissa. And yes, I get the hint, 5 minutes. Okay. I can't see my slides, but no, there we are. Okay, so we've already had the introductions. Thank you so much to the organizers for inviting me. Thank you to all of you who've come to take part and to listen. I'll be really happy to have a great discussion about this. So I'm going to give a perspective of someone who's worked for many years in Africa and who's worked for less years, I would say, overseas, and contrast what are the two different environments and the impact they've had on me as a researcher who's working to make malaria history. So I think the first point I want to make is that the global challenges that we face today, they're not going to be solved today. I think you can all appreciate that, COVID came. It's not clear that COVID's gone. We're still getting fourth boosters. Many people are still waiting for vaccines. And it's just an example. What the challenges we face are here. They've been with us for a long time, and they will be with us for a long time. And what I think is really important to do is to secure the next generation, the people who will carry this work forward. Right now, we're here at the World Health Summit, but these young people are the people who will be here at the next World Health Summits, and we have to cultivate them. And I think that it's important to appreciate that it takes time. It's not a quick fix. It takes time before you build a young scientist who's just come out of university and you turn them into a professor. That's on average 20 years. It doesn't happen overnight. So when we think about capacity building, it's really good to frame it in the context of this is a long-term investment, but an investment that's absolutely vital, especially for the Global South. The next point I want to say is that, especially for laboratory sciences, science is an international affair. And I'd be happy to have a vigorous debate about this. You do your best science in the best lab in the world. So there's a lot of conversation. Oh, they shouldn't go abroad. They'll never come back. Oh, they must stay in Africa. I really want to push back most strongly against that. You do your best science in the best laboratory for whatever you're practicing. And in my own example, working internationally has propelled my career forward. It's helped me understand that I'm as good as anybody in the world, contrary to what I've always been told, that us in Africa, we can never do nothing. I could see that I was just as good as anybody in the world. And that was a big mind shift for me. It helped me to see what I could do myself. When I started, I thought my work is to put papers in PubMed and then others can try to make vaccines. But along the journey, I've become to understand I too can make vaccines. I don't have to wait for someone in Berlin. I don't have to wait for someone in Geneva. I too can do it. It's given me the connections. Now I'm at Imperial College London, something that would not have happened had I not had the international exposure. So I want to encourage us, stop being afraid that people will go away and they'll never come back. I think that it's a resource and it actually helps the career to have that change in science. The next thing I want to say is partnerships. Partnerships between the Global North, the Global South. They're really, really helpful. But the partnerships must go beyond sample collection. I've been in too many meetings where that's what a partnership means. You collect samples, you send them to us in Berlin, and then we're going to do X, Y, Z. But in fact, if we're looking forward to sustainability of the whole science enterprise, we have to move beyond samples. They're really important. We've got to take our scientists through understanding mechanisms. Once you understand the mechanism, you can begin to perceive a product, an intervention that could help in the situation, and then you can think about implementation. So I really want us to think across the pipeline. And this is my second last slide, that yes, we have to have good institutions in Africa. Again, we'll have the debate. People say there's nowhere to go back to. Yes. Our institutions need strengthening. Within those institutions, you need mentors and you need role models. That's true. We need infrastructure and support. The difference working, the science that I've been able to do overseas compared to what I was doing when I was in Africa, I can't even compare. And that's because of infrastructure and support within the institutions overseas. I think it's time to embrace women. Too many people are still too scared to have a woman who's in charge. We're trying to help. We're not trying to break down. I think we should embrace women and encourage our women. They're just as good as the men. Come up. I think we should embrace scientists in the diaspora. Sometimes we try to go back and we're being pushed back right from home, right? That you've been out there, you don't know what it means to be at home. I think that we should look at the scientists in the diaspora as a resource. These are people that have training, people that have skills, people that can support and help train. And of course, funding. That's a continuous song. And I just want to end with this save the date. This is a Congress, biggest immunology Congress. It's happening in Africa for the very first time in Cape Town next year. Just encourage you, save the date and come and see for yourself the science that's going on in Africa. Thank you.
Thank you, Faith. This was a very heartful speech, I think, summarizing a lot of points we can discuss later on in more detail, I guess. And with this, I would also really like to call the next speaker, which is Dr. Michael Makanga. Dr. Makanga is a clinician scientist with 27 years of professional experience of working on health and poverty-related infectious diseases, more specifically also in medical product development and clinical regulatory activities, which are, of course, important considering his current role as an executive director of EDCTP. And before joining EDCTP, he obtained his PhD in clinical pharmacology at the Liverpool School of Tropical Medicine. He's, of course, has been part and still is part of many advisory boards, ranging from philanthropic organizations to the World Bank. And I'm happy and really proud to have Dr. Makanga today on our panel to discuss with us. Dr. Makanga, please give your speech.
Thank you very much, Madam Chair. And good morning, ladies and gentlemen. It's very inspiring to speak after Professor Osler, who is actually a product of the program that I'm going to speak about.
Product.
Yes, the European and developing countries clinical trials partnership delivers an integrated approach in the development of medical interventions against infectious diseases. And this is a partnership that is mainly involving Africa and Europe and has global involvement of partners that are involved in research and development and developing the related capacity in these areas. And looking at the bull's eye, that is the focus of the focus of the program, and that is clinical research and delivering medical interventions. This is where we spend most of the money, about 84%. And this is not delivered in abstract. We do this in an integrated manner. First of all, by developing the people that are to develop it. And here we have short-term and long-term training approaches. And also we have a very comprehensive fellowship program, as I'll speak to it. And then we have institutional capacity development, which we've delivered in different ways, including through regional networks of excellence. And then we have other programs that address development and responding to disease outbreaks, epidemics, and also responding to the pandemic, and making sure that the product that are delivered reach the people that actually need them. And as you can see, we are covering most of the infectious diseases that affect Africa, while paying attention to issues like the antimicrobial resistance and also climate crisis related problems, which may affect diseases like malaria and diarrhea diseases. The program has a footprint in 44 African countries. And as you can see, it is cutting across languages, covering a majority of the French-speaking countries, all Portuguese-speaking countries in Africa, and majority of the English-speaking countries. And all this is done through different consortia working collaboratively at all levels. Talking about developing people, here we have a very comprehensive program, right from the entry level, where we're helping individuals learn how to write grants and respond to preparation of their own applications to bring in the money to do the work. Developing them as individual researchers and also being able to attract back those that have trained abroad and developing their research teams. And then developing excellent research leaders that are globally connected, as we've just heard. And in addition to that, paying attention to equity, where we pair up the research leaders with excellence with the upcoming scientists in other high burden disease countries. Another model we've used, looking at the different capacities of institutions, we provided seed funding in a on a long-term basis, pairing up institutions that are excellent in conducting research with complementary capacity, and also linking the upcoming institutions in high disease burden areas with them. And here we are supporting 4 regional networks of excellence in the Central Africa, East Africa, West Africa, and Southern Africa. And embedded in this are different training programs. And as you can see, highlighted in red, are countries that are not being left behind, and they are receiving additional training for their individuals to develop scientific excellence and leadership. We've also invested in health systems preparedness for outbreak response. Following the Ebola outbreak in West Africa, we invested in large consortia that are preparing to respond to these outbreaks. And in the peaceful times, they are doing their normal clinical research activities. And when outbreaks come out, they respond. And these have been key in the response to the COVID-19. Based on the work of the Consortia for Epidemic Preparedness, their work has contributed to the good practice document that has been released by the Essence and the UK CDR that you'll hear a little bit more about, implying that it's not just work in abstract, it is influencing good practices. And this is where we'll take it from there. Thank you very much for listening.
Thank you very much indeed, Professor, for all that insight. Let's move on now to our next presenter. Our next presenter is Dr. Spielberg. Dr. Spielberg is head of division at the Global and Public Health Research at the German Federal Ministry of Education and Research. She joined the ministry in 2002. And between 2002 to 2017, she headed the division for higher education policy. Dr. Spielberg is actually a lawyer by training, and I'm really intrigued and interested to hear your presentation on this issue of capacity building. Over to you.
Thank you very much, and good morning, everyone. I'm very happy to be here. Just to clarify, I'm not a doctor, so I speak about research capacity building from an outsider's perspective. Okay. Of course, research capacity building is a very complex issue that requires many different elements to come together. I would like to focus on 3 core elements. And basically, we have heard all of them mentioned in the previous speakers' presentations. Stating the obvious, of course, we need to strengthen individuals. They need a stimulating research environment with excellent scientists around them to train them and to exchange ideas with. We need to support young researchers in their career development throughout time. And of course, as Faith mentioned, it takes a long time. And they need clear career perspectives to know what they're signing in for. We also need to strengthen research institutions and infrastructure so that they're attractive for these scientists. And for example, we need to build up sustainable centers for clinical studies, but we also need to have institutions that are capable to administer funding from many different funders. So we need institutions with the respective administrative skills. And last of all, and I think that is the most important part of it, we need to strengthen interaction to exchange ideas and learn from each other. Interaction between disciplines, between different stakeholders, between countries, you name it. Let me illustrate what I mean by giving an example from our funding portfolios. The research networks, I never can say the name right, Research Networks for Health Innovations in Sub-Saharan Africa I wasn't the one who thought of this name. They're one of our flagship programs in global health, and they provide excellent opportunities for capacity building in all the 3 dimensions that I just mentioned. Of course, hopefully, they conduct excellent research, and they provide ample training opportunities for doctoral and postdoctoral students. But in order to be sustainable and implement research results into practice, we need local leadership and achieve local ownership. And this is why in the networks, not only the research topics are chosen by the researchers based on the local needs in sub-Saharan Africa, but also we have the African scientists in the lead as the main coordinating PI. And they receive direct funding from Germany and not as it used to be through their German partners. So we really have a cooperation at eye level. And I think that is a very important element of this measure. This is why we also provide training opportunities for administrative staff at the participating African institutions. And last but not least, the networks give room for interdisciplinary and multilateral cooperation to achieve the best scientific results. Implementing scientific innovation into practice also requires interaction with other stakeholders beyond the scientific ivory tower. So we also support interaction with patients, with politics, with local communities and the general public. And I have to admit, this is still not working as good as it should. And I think that's where we have the most homework to do. Homework is not only, EDCTP, I'm not going to say anything about this now because we have just heard from Michael. Let me just mention that also from the German view, it is a very important good practice example for capacity building, and we have been a strong supporter of EDCTP from the start and continue to be so for the new program. But everything you need to know, Michael has already mentioned. Capacity building is not only an issue for international cooperation, we also have some homework to do at home at the national level. And I want to highlight 2 measures that I think chip in on the requirements that I mentioned in the beginning. Until recently, the BMBF research funding of global health has focused on biomedical research. So the global health research community in Germany was not very diverse regarding the disciplines involved. But of course, it's obvious that you require transdisciplinary cooperation to solve the issues at hand. This is why, as was already mentioned by Clarissa, in 2020, we initiated the German Alliance for Global Health Research to provide opportunities for networking across disciplines and also funding of interdisciplinary cooperation. It's a joint venture, if you wish, between the BMBF and the Ministry for Economic Development and Cooperation, who provide funding for international cooperation. And one last example to mention the sustainability aspect. We need long-term career perspective, as was highlighted by Faith as well. With the junior research groups on infection research, we provide funding opportunities for promising scientists for up to 9 years in order to help them obtain a professorship. The funding is decreasing over the years, and we expect the host institution to step in with their support for the group leaders and provide continuous funding after the BMBF funding has ended. With this commitment, we hope to ensure sustainability. I'm not sure whether it will work. We will see. We have just started this a couple of years ago. That was just a short glimpse from my side on some of the issues and examples from the German funding portfolio. Many other important aspects have been mentioned by my colleagues, and I look very much forward to our discussion. Thank you.
Thank you very much for those highlights and insights from the Federal Ministry on what is being done nationally, but also internationally in this area. Moving to international issues, my next speaker is somebody who works for the World Health Organization, WHO, Dr. Gary Asian. So Dr. Gary Asian is the head of partnerships and engagement in global health at WHO, and has quite a lot of experience in different countries. He is responsible for linking up programs in different organizations, and we area head about the Essence program. Gary is also responsible for that. And talking about vast experience, Gary has worked in different countries, including Brazil, South Africa, Armenia, Barbados, Vietnam, just to mention a few. Gary, the word is yours.
Okay, great. So I'll time myself and hope to be on time. So I'm going to look at my slides, but hopefully also at you, and give you a 5-minute update on how we have done this. Obviously, TDR is within WHO. It was already mentioned, but we're also, does that work? Flipper?
No, I don't think so.
Okay,
Yep.
Now it does. So we are hosted at WHO, but we're also part of co-sponsored program, and you probably have heard of us. Now, the reason I put this in here is to talk about two things. Somebody already mentioned that you don't do capacity building in one day. Obviously, since 1975, TDR has been trying to do this, especially before there were a lot of global health programs that you have now, and that's very welcome. But looking back at 1975, that was not the picture. The other obvious thing here that is a good practice or a good 50-year experience is the countries and funders were part of the decision and the way we've done things since the very beginning. A lot of the recent reckoning, so to say, around who leads and who is in charge and who funds and who follows has been ingrained in our structure from 1975. And that actually allowed us to have that reach and use very small amounts of money, but also have a lot of impact as well. But the recent changes and recent trends are quite welcome overall, and that's something we need to keep up with global health. Is that me or? No. Am I doing it the right way? This one, no?
No, this one.
Oh, okay. And capacity building has been part of our mission since the very beginning. Perhaps I was clicking on the wrong button. It's important to recognize that capacity building has been part of it since the very beginning. And we always, and this is also something to reflect on here, that no research without capacity and no capacity without research in terms of how some of the good approaches to sustainable research systems in countries should be moving forward. Why are we doing this? We've moved a lot from clinical and we've focused on implementation of health programs. So obviously clinical research and clinical capacity are fundamental in producing the evidence and tools. However, if we want to achieve universal health coverage and be part of the overall health workforce, research capacity has to integrate and be part of that evidence use, production, and also application of that evidence in real health system, but based on evidence with the inclusion of people who have been trained or who are in the system, who understand evidence. And of course, here are some examples why this is urgent, because since the pandemic in 2020, we see actual reversal in the huge number of indicators when it comes to infectious or other diseases. There's no month or a year goes by that shows a report that we're actually going backwards. So here are different ways we do capacity building. And I won't go into the detail. There's no way I can do that. We also have universities in the South that we work with. TDR used to send our students to the North, but that's no longer is the case. And we have a number of universities which achieve few things, and I will say this when we have our discussion. And we also have research capacity strengthening centers that we work with. They are standalone in their own way, but they're also not for only researchers. They're also for policymakers, people who work in the system, who can take a short course in ethics research, in implementation research, in good practices, in other areas that do not take them away from their day job. Another way is sorted, also not taking people from their jobs. They work in public health, they come and spend a year with their peers working on a question that is existing in the system and needs an answer in a year. No one is waiting for us to come up with the research in 5 years and when we all will move on. We move to a lot of digital tools. I can't cover everything here, but a lot of this online. And also a lot of people who were involved in this switched very quickly to helping the health system at a time of COVID. And good practices were mentioned here. And Essence is, Secretariat is at TDR, but this is something for funders as well. No one has the key and to every answer. We need to learn from cases and good practices, and funders have been really interested in this for the last 10 years, working on different good practice documents and approaches that will help each funder to improve the way they fund, but also those who are involved can also learn from that. So you can find more about it. So in capacity building, no one has the answer. Just all of us working in global health should always reflect on, we have to have a certain amount of humility to learn. And this is something I picked up in most of the recent episodes of a podcast we have, Global Health Matters, that really was mentioned that one of our guests really reiterated this point, that we are here to learn from each other and not to make the same mistakes and actually achieve some results at the end. Thank you.
Thank you very much. That's really interesting and intriguing last word there. No one alone has the answer. We are here to learn from each other, and we can do this together. With that, I would like to kind of open the discussion for this panel with a question. And this question is something that has been highlighted before in other presentations. So we heard about, let's think about the across the pipeline, developing people, and also making sure that the expertise are globally connected. We heard about evidence-based interventions. We heard about the importance of multidisciplinary approach, and not just one area can do everything. But then the question is, we've just had the pandemic, and we know how disruptive that has been. Professor Makanga, would you help me start on this discussion on, has the COVID pandemic affected the way you have, in concrete terms, approached research capacity building? Or are there other things that we should also be looking at? So not just the bigger words like multidisciplinary approaches, but also being specific to issues like socioeconomics, all those kind of areas that affect people. Has the pandemic affected the approach for capacity building in terms of research?
Thank you very much. Yes, it has. And in our experience, I would like to bring up 3 areas. One, starting with the people. We've really seen firsthand the value of investing in developing local scientific excellence and leadership. The people that we have invested in the various countries, for example, through the fellowship program at the senior level, are the same people that have stood up and taken on the responsibility in the national advisory committees. As you recall, many of the disease experts that are working in countries were called back to their own countries to help their own country's response. So the people locally had to stand up to take care of the problem. So having people that have scientific excellence and leadership locally and yet able to draw in external expertise was key. But beyond this, we are dealing with a new pathogen. So this brought up another dimension that you need to train people that can diversify their skills to respond to new emerging problems. Thirdly, rather secondly, on the level of institutional and government, it has become very clear that there is need to invest in the local capacity in terms of health and demographic surveillance of the diseases during the time when it is peaceful. And these people have to be working on real research such that when problems come, they can diversify and appropriate the expertise at the time of response. And third point I want to say is collaboration. And collaboration is not just between people and institutions, but working with local or regional bodies. The work we do and the response has been heightened by collaboration with the World Health Organization, collaboration with the Africa Centers for Disease Control, collaboration with the Africa Medicines Harmonization Initiative. All these are enablers, and that collaboration is key, and capacity has to be built at all these levels. Over.
Thank you very much, Prof. Actually, you ended that contribution there by talking about collaboration even with regional bodies. With that, could I ask Dr. Asnyan to give us some insights in that area as well, if you have? Thank you.
Sure. That one? Okay, great. I can do that. Thank you.
Yep.
Just to build on Michael's comments, obviously, to look at the issue of time of peace versus time of war, or whatever we call it. But I mean, at the end of the day, there is no such a thing, because there is no such a thing as a peace, because every country has their own infectious disease or other outbreaks or other issues. So there's no answer to saying, yes, we only have to wait another 10 years, there's going to be a pandemic, let's prepare for it, because it's not going to be the only one, and it's going to have different shapes and forms in very different ways. So that while it helps, it does also kind of makes things black and white versus we need to do things now. So Chinese proverb, when is the best time to plant a tree? 100 years ago. When is the next best time to plant a tree? Today. So if we do not have capacity in countries that is more general and is really there, and institutions are built and capacity is there, not only for certain things, but for things that are there, can come up and people can quickly switch. One of the examples I gave was people were covering TB and they had to quickly switch to COVID. Now, if they were only trained or they only knew about TB, or they didn't know about epidemiology in general, or how to give advice or write briefing notes for their heads of agencies or ministers so they can actually speak on the topic of pandemic, they will not be able to do that. Hence, you're not going to train people for everything. So important to look at general skills, research, but also evidence and use of evidence. Use is the key word of that sentence, because you don't have to sometimes do it yourself. You can use, but if you don't know how to use, you're not going to be able to use it. Second part is learning from COVID. maybe some are learning from COVID, but some others learned from Ebola. For example, in the time of Ebola, we knew that issues around community engagement, ethics, other issues were just as bad as maybe at the time of COVID. And this was way before that. It was just not in the news and or was not as sexy to talk about, and it was not global. And in fact, Michael will remember at the time EDCDP and TDR, we had a joint program where we involved researchers that will look into community issues around at the time of outbreak and learning from Ebola. And I know at least one or two of those groups have actually produced things that were then useful for COVID. And the third part is we should probably, again, what we learned from COVID, we should probably make an extra effort to see what is the digital or the digital tools we have and how can we do this? Because I take Faith's point around being involved, but sometimes, like, even if you look at your own schedules, you cannot be everywhere all the time. So it's good to go to places, but at the same time, it's good to be connected all the time with others. So that's even better in terms of making sure that what you do is not any less or more. So there are other ways in addition to being part of international community. So digital learning, digital platforms, and all of that definitely is our future if we want to really make capacity a global issue.
Thank you very much for those responses, Clarissa. Do you want to expand on that, or do you have another question?
Well, I'll just catch the ball a little bit on the issue of to plant a tree today. And with that, I would like to hand over to Faith. But before that, I would just like to summarize very briefly. I mean, what you mentioned is very interesting. And we've heard this now 2 times, this topic of diversification, right? And diversification, of course, is a challenge for scientists, for sure, because they're born and raised in a unidisciplinary manner, for sure. And this is how they build their careers. And I think COVID-19 posed a challenge, but also a big opportunity, for sure. And with this, I mean, I would like to hand over to Faith with this question of if we plant a tree today, like you said, Gary, then where should we plant that tree, and how can we make sure this tree gets water? So how can we address the issue in the end of brain drain and bring the water back to the tree where it was planted, right? So Faith, maybe you can share your ideas. I mean, you have done this already in part in your introduction, but I would like you to expand and share your ideas here.
Yeah, thank you, Clarissa. I want to first say that, you know, whilst the pandemic made global health a topic now for everybody, you know, it's for me a painful topic, because while it became global health, equity was obviously not there. We collaborate, but when the vaccines are there, they're only for some, they're not for all. So it's still a very painful topic. And actually, COVID was a pandemic, but there are things going on in Africa right now. Malaria, HIV, TB, neglected tropical diseases. There's so much going on in Africa that's holding people back, that's killing people, that's you know, holding the economy back. All that's been happening. So while the pandemic is good to sort of energize us, there are everyday problems right now, and they've been there and they're still there, and they need the capacity. So I think I was happy because, not happy, it was, you know, the pandemic made people at least in the West, the global North, remember how it feels to be sick, remember how it feels to have a health challenge, which I think sometimes we get disconnected from. But in places in Africa, people are facing these things every day. And that's why I think it's it's really it's an emergency, although it doesn't feel like an emergency. It's somewhere far away. You don't get bitten by mosquitoes here, etc. But these are real problems that are there with us every day that we need to work on. So on the issue of brain drain and brain gain, brain circulation, so my view is this, that science, as I said, is an international affair, that people need to get skills in the best place that they can get skills. Some of those people will choose to remain. Some of those people will choose to go back. I don't feel that it is the right of anybody to prescribe to anybody else that since you came from Kenya, you must go back to Kenya. I don't think anyone should put, you can't put life in boxes like that. I think that people should work to solve global challenges wherever it is best for those individuals, and those are individual choices that people should make. The important thing to me is not where you are. Of course, it's lovely, it's wonderful to have people on the continent. You need those, but it doesn't mean that people who are not on the continent cannot work. So I think that we need to change the narrative here. We need to focus on solving the global problems. We need to provide people with the training, with the opportunities, and let them work on those problems. But I don't feel that we should prescribe that, because you're here, you must be here, you must be here. I think those models are outdated. With the connectivity of the globe, you can do your science anywhere. I work on malaria. I've worked on it from Germany. I've worked on it in Australia. I've worked on it in England, and I've worked on it in Africa, and I'm still moving. So I just don't think we should, I think it's a bit narrow-minded, that narrative, and that we should come against it strongly.
Thanks, Faith. And and also this matter of planting a tree today, I would like to just ask Frau Spellberg. I mean, because you are supporting this issue for sure, and maybe just a specific question during your talk. What I was intrigued about, these junior fellowships that you mentioned, reminded me of, is there in BMBF, very concrete question, obviously, to BMBF, but, and we've been discussing this issue as well. So support of local professorships, junior professorships in low middle income countries in sub-Saharan Africa, in universities which have MOUs with German universities. Is there any scheme that you could recommend or that BMBF is actually thinking about? Because obviously that also entails long-term capacity building.
We don't have such a scheme for specifically for global health. We have something with mathematics. We support mathematic professors in Africa, and there are a couple of other programs that are specifically designed to support professorships or postdoc students in other countries abroad, but it is not the usual way. And I think that is in a long-term perspective, that would be something that we would need to work on. It is very difficult because it collides with the usual laws and regulations that we have for our funding. And to change these, you have to talk to people at the Ministry of Finance, at the Central Audit Court of Germany, and they're not very familiar with, issues of international research exchange. And so to raise awareness there that you need to adapt rules and need to create new possibilities for the international cooperation that is so important. That's a very long-term project.
So could BMZ also be of help here?
Of course, BMZ, they have more instruments for funding at the international level, but then of course they focus more on the implementation of results than on research. But we are in dialogue with them, obviously.
Okay, good. Thanks a lot. So I hand over to Mikis.
Yeah, I would like to take on that discussion actually further. So indeed, these rules that are there may be very difficult to kind of change. There's need for dialogue. But one other thing that at least I've noticed, maybe not in medical sciences, but in natural sciences where I come from, is this thing called the leaking pipeline. So in terms of gender, we find that at junior level, we have quite a lot of female scientists. But as we move along that career pipeline, we actually lose them. And then we have very few female professors, as an example. What's your take on this? And how can we bridge that gap?
Well, it is a huge problem, and we don't have the perfect solution, and it's a problem everywhere. It is a problem in Germany, and Michael can tell about how we try to get female scientists for the EDCTP program. I think also here, there's no quick solutions. I think especially for natural sciences, you have to start much earlier. You have to start in school to get girls interested in these topics. At least that's an issue in Germany, where many girls are not usually interested in natural sciences. But then, of course, you need specific measures to support women throughout their career development. Things like mentorship, I think, are very effective, but also specific support, for example, temporary deputyship during childbirth and the year after that, during maternity leave, that's the word. Specific conditions for working arrangements that provide better compatibility of your professional life with your private life. Basic things like, I don't know, supporting childcare during conferences. So to enable young women with smaller children to travel and participate in conferences without, having the problem of no one looking after their children. I think, well, there's just so many things to do, and we have to, and the pipeline is leaking at so many different places that we have to really address every one of these leaks with specific measures. But you also need to raise a general awareness that this is an issue and that it's important, and that it's not something you do for the women, but it's something you do for the whole system and for the benefit of research and scientific exchange. And one last thing is learning from others. We might not have the best solution in Germany. We're still facing huge problems in that area. So international exchange, learning from others, what are their experiences, what are their examples, do they face this issue? That is an important aspect as well, in my view. Thank you.
That's a real good point as well, learning from each other. And I think Faith has some contribution to make as well.
Yeah, so obviously I'm a woman, and I hope it's obvious. And I came through the path.
I like that.
I came through a difficult path, having children, trying to have children, having lots of miscarriage, and a struggle really. And what helped me was leadership, the leadership that understood that you need a bit of time out and didn't therefore lock you out. I've been in conversations where people say, oh, that one is too interested in family life. And, you get locked out of the next level because people perceive that you're not committed because you try to have a child, although they themselves were born by someone. So one, it's leadership, that we must keep our eyes open for the girls, for the women coming up, and make sure that we keep the doors open for them. When they have to step out, they have to step out for good cause, or the planet wouldn't exist. But we have to keep the doors open for them to come back. So the second thing is the partners of the women. One of the most important things that's helped me to succeed, why I'm here today, is because my partner is at home with our 3 children, and I can be here today. So this is a societal problem that every man in the room, look at yourself and ask, am I supporting my partner to do what they need to do? Because without that support, the women remain in the shadows. And the only reason I have moved the way that I have moved is because my partner allows me to do that. And so whilst we like to blame lots of other things, people should do this, people should do that, I think the change starts with us. If you've got a wife or a partner that's working in science, it's your responsibility to make it work and give space for women to grow. Yeah, so that's what I want to add.
Couldn't agree more. Yeah.
Thank you really very much for responding to that question with even some personal experiences. I really appreciate that. Clarissa, how do we take that forward?
How do we? Oh,
Should we go to the audience?
That's not nowhere to take forward. That's already a solution. I think that we can all share our experience on. And but I would like to come back a little bit to TDR and the work of TDR. And Gary, you mentioned how important it is also to move forward based on evidence that is generated for implementation. So maybe can you please share with us a little bit about the research capacity that is needed to generate this evidence actually? Because of course, also one of the aims of this workshop is also to identify potential gaps, I think. And I could sense that there might be some gaps, even though we have not even discussed this question before, right?
Yeah, you'll see how good I am or bad I am on the spot to answer your question. But can I go back to this issue of gender, but also the issue of brain circulation or whatever that is most fashionable to call it these days. But and just say that all of that I completely agree. The only part, and this is something we've been working on, that we need to kind of break away from, is this issue that you always have to be studying in some northern institution. And that is difficult, and that creates gender issues, that creates return issues. If we do not give up that thought that you cannot get a perfect global, excellent education in a low and middle income country, we'll never resolve this issue, because there will never be enough, and there will never be any of the things that we talked about will never be fixed. So hence, we have given up working with northern institutions, because the universities in countries and northern institutions can work with those universities, and that's the obvious way. But if you are a 7, 8, 9, 10-hour flight from a university you attend, what pipeline? I mean, pipeline will be leaking in the air. So if you're a 1-hour flight, or you're in your own country, in your own region, in your own cultural setting, but the university has the best program, is rated nicely, has great programs, works with northern, southern, all over institutions, well, the chances of you not worrying about return or not return, circulate, or also the issues around family, support of your family, etc., might become has actually become, we see from the last 6, 7 years of the 8, 9 universities we work with, all in low and middle income institutions, and all needing support and partnership with universities all over the world, which have more background, etc. So this, I think, our success will be that the universities in low and middle countries are just as good as the ones we are talking about. If we do not see that, I don't know. So keep that in mind for future. In terms of gaps, working in research for evidence is 10 times more difficult because you need 10 times different kinds of skills. You need an ethnographer, you need an economist, you need someone who is working in social science, someone who is good in language, sheer language perception. Same words don't mean the same things in the world. So the list is long. The guideline that will come from WHO is written in English or then translated, but that does not mean it's the same thing in each country. It means different things in different settings. So implementation kind of research is not that easy in terms of the complexity of the question, but also pressure. The answer is needed tomorrow. Well, they've asked you a question today, they need it now, not a year from now. And if you can negotiate and say, can we answer that in a year? You're lucky if those who need the answer would say yes, because they may say, sorry, moved on. So that really changes the dynamic and the quality or the impact that research would have on the actual health outcome is just as high as any other research. There's no one better than the other, right? Because that's another thing we have to kind of give up, that one is more precise science and the other one's less precise science. Well, if it's precise or not, if saved life, for me, it's precise. So there's no question about that. So the range of capacity is quite high. Adaptation, implementation type of questions that are adaptable and are answering questions in countries. Majority of people, decision makers in countries, do not want a study done 10,000 kilometers away and all of a sudden it's going to make sense to me. Not going to make sense to me. I'm not going to even be able to explain why I'm using it. I mean, I'm only going to be able to explain why I'm using it if it comes from some northern, really rich country. I'm going to say, hey, it's done here. Let's try and do it here. But if I say it's done in some other middle-income country, people look, say, you sure you know what they're doing? Well, you don't, because it's a different country, different culture, different setting, different socioeconomic, other political governance. The list is long. So the understanding of the broad range of capacities that are needed for this kind of research, I think is there. We just have to look at it and make sure that we do it and also produce them or have institutions in countries that can do it themselves with our help and our engagement.
Yeah, that's a very good point. And maybe to just a question about funding. I mean, how is that funded?
In terms of, well, for TDR, it's very easy. Well, it's a original PDP, so to say, because it was a place that funders put together funding, and then we've devised this programs, and we've moved, as I said, to having this 8-9 institutions that are funded, and those who apply from regions apply, they get scholarships, but also there is a support in terms of these 8 institutions are in a network. They have a common implementation research curriculum. They do a practicum on an implementation issue if in their country or wherever they want in their region. And obviously, at the end, they go back and they work in their, they're not going to get a PhD or if they don't need to. And in fact, if you do a good MPH with a nice project that looks an implementation issue, to work in a ministry, you don't need a PhD. that is fine, but you do need to understand evidence so you can actually be able to interpret what's out there and put it in front of your decision maker, and or you are the decision maker sometimes, and you have to do that yourself. Another, again, funding this training centers that are not there to train you for 7 years. They're there to train you for 2-week course that you need because you're trained in microbiology, but you want to do implementation research. Of course, you know the research methodology. It will take you maybe an online course to switch, to apply your basic PhD in whatever else you've done and build on that to engage in a more other implementation kind of area that you are there to. You don't need to get another PhD for that, right? So these training centers are there to do exactly that. Let's say if we talked about Ebola and the issues around Ebola. Well, people worked on it, but they've never taken any ethics courses in complex situations of outbreaks and issues around, ethical issues around doing research. Okay, well, you take a 2-week course to fill that gap. You don't need to take a whole PhD for that or master's. You take that. So there are different ways how we do that. Of course, we are very much interested in, and they're funded, of course, to do that as well. But the amount, like, we're a small program. The amount of we can always increase if our sort of core support increases, but we don't need to do it ourselves. Those are examples of things how they are done, and they can be emulated and used, and institutions can actually build on that. And there's a huge opportunity for German and other institutions to work with low and middle income country institutions to do exactly that.
Exactly. I think that's very excellent that you highlighted this one more time, because I'm not sure whether the whole audience is aware, especially also our young people, about these opportunities, obviously, right? Because they're also an opportunity, which I mean, I would like to pose one more question to Dr. Makanga. And what you have highlighted in your speech, and I thought this intriguing, was your in the program of EDCTP, that there is also something that I would call an outreach component, sort of reaching out to the community and also reaching the people and communicating with the people where in the end which should profit from the research. So could you just briefly highlight or give an example of how this is in the end actually put into place during such projects?
Thank you very much for this. First, if I may move a step backwards, we are accelerating delivery. Development of new interventions. And these are normally evaluated in controlled settings. And these are aimed to be implemented in different contexts and using different delivery systems. In this case, we take an extra step to evaluate products that have been evaluated to be safe and efficacious, to evaluate them in the real life environments and using the real life delivery systems in the health systems. That also calls for working with frontline health workers, working with communities, working with the people that take up these interventions. In this case, we have to incorporate this component in the way that these studies are designed to engage with the people that are going to take up these interventions. And also when results are generated, these results are shared with the people that are taking up these products. At the same time, we engage the policymakers that are going to implement this at the policy level. And then moving on to the communities, we realize that we have different social determinants of health. People that have different demographics, in different demographic settings, different age groups, different practices, different diets, different living environments. To understand this, we have to incorporate some of the social elements that bring out the context where these products are being rolled out. So this is the way that we engage with the communities. And actually, this is where other elements come in. You'll find that we normally talk about the impact of climate. Often we miss this, that these impacts on the health systems in different ways, the impact on the disease epidemiology, the impact on the occurrence of disease outbreaks in diseases like malaria and diarrheal diseases, but also on the health systems themselves. You know, when you have outbreaks, then the health systems are clogged. And we are now having an increasing conflict between research or clinical research and patient care delivery. So this is where the integration of the two are important. So we don't only do the superficial development of interventions, but we evaluate these interventions in the real world and at the at the point of care delivery, and also in the integrated fashion with patient care delivery. Thank you.
Thank you very much. So, Michael, Mitek, sorry.
Yeah, thank you very much. I think at that point, we could actually move to the audience if they have any questions. If you are still thinking about your questions, I have one that's online, and we can actually go to that one. The question is, how can we incentivize research students from low and medium and middle income countries? I would actually say students in general, to be honest. How do we incentivize students to keep going in pure science research rather than dropping out to pursue jobs that would make their living? It's the question online. How do we incentivize research students to keep going other than let them drop out and go start making a living? Specifically, they are talking about low to medium income countries, but I think this is a general problem, really. Anyone on the panel? Beth, you're smiling already. Take it on.
It's very important to make a living. You must eat. Your children must eat. It's very important to make a living. But the research career is not for the faint-hearted. What I tell young people is you must understand yourself, understand what really drives you, and because you're gonna face so many challenges when you decide that research is how you're gonna feed your family, but as well as satisfy your interest. So I think that it's very practical, and I really agree that you must earn money. I mean, I always remember my parents trained me as a doctor. When I gave them my PhD thesis, they were just wondering, now, what's this? I mean, you know, you're supposed to have a clinic and make lots of money. Now you're giving us a book. So what are you saying? You know, so they have hard decisions to make. And I just tell young people, take time. If you look at the opportunities that are in front of you, but listen to your heart. If, you know, in the end, if you're doing something that makes you excited, makes you jump out of bed every day, that's what's going to keep you going in a research career. Otherwise, you might struggle. So take your time. But yeah, you must eat. I agree.
Frau Spellberg.
I agree that it is very important to have an intrinsic motivation as a researcher, but I think there's also some framework conditions that could help you to stay in science. And for example, in Germany, we had a long discussion about that at the time when it is decided whether you get a professorship and how long you have to live with short-term contracts. And at least here in Germany, you are in short-term contracts until you're 40, 45. And that is way too late for you if you want to start a family, plan your career. You need a much earlier perspective on whether you will eventually be able to stay in the scientific realm or not. And so that is something that is within the responsibility of universities themselves, but also of the funders to set a framework where such a decision can be taken earlier on in life, so that you don't stand at the age of 45 in the middle of nowhere and have nothing left because the ultimate goal has not materialized.
So we have another question from the audience, please.
Thank you for, first of all, for the panel, very inspiring. Thank you very much for your statements. 2 points from me. First of all, on the donor, and I will present myself, Luis Pizarro from the NDI. About the donors, I see a trend to separate what is research and development one side, and in the other side, health system strengthening. Most of the time, workforce is on health system strengthening. So what are your recommendations not to forget when the donors are funding research and development to fund training and all the capacity building on research? That's my first question. And the second one, I mean, when we talk about global health, it's still about North and South, health from development countries, LMICs, and if we could move away from LMICs, because it doesn't mean nothing, to compare. I come from South America, what is happening in Niger, in Asia. So it's so different. So I think we should move away from these LMICs. But second, we're not talking about research in global health. And I think we have so much to learn, as you said, from each other. But I think universities in Europe and in the US have to learn a lot on global health research about what is coming and is doing in other regions. So what are your recommendations for the next World Health Summit? Have a session on how the whole world is teaching about really global health research on that. Thank you.
So maybe the first part of the question maybe goes to Michael and Frau Spellberg. I'm not sure.
Right. Coming back to what has been raised, actually, I'm an advocate of integration, research, clinical research, research and development, and finding a way, an appropriate way of integrating this with patient care delivery, making sure that the two are not living in conflict. And this becomes key, especially for many of the diseases that are managed at different levels of patient care delivery. The question that has been raised actually is coming from the NDI, and you'll find that many of the diseases that they are dealing with are involving neglected populations. And these are people that also come to seek healthcare. When these are evaluated, if they are going to be effective, you have to take care of the two so that there is that integration even in the evaluation stage. Secondly, you've mentioned about the issue of global health and sharing of experiences. Time has not allowed for us to go deep into this. For example, the approaches that we use are involving a lot of collaboration between academic institutions and product developers. Because when products are being developed, they usually start with academic institutions, then they involve small, medium enterprises that are dealing with the biotech companies, and then they involve the big partners on the pharmaceutical side that have a long-term perspective in product development. So there have to be that collaboration and also the evaluation of these across different regions. So that aspect has to come in all areas. So I'm for promoting collaboration across public and private, and also for integration of research and patient care delivery. Thank you.
And
Yeah, thank you.
And just to add that for your first question from the perspective of a funder, collaboration is the key as well, because, for example, in Germany, our ministry can only fund R&D and it cannot fund health system strengthening in the areas that you mentioned, but that's in the realm of the Ministry for Economic Development and Cooperation, the other way around, economic cooperation and development. And here it is, of course, very important that we know about each other and about the different programs, and that we have some kind of alignment on how one funding can lead to another support by a different ministry. And it works most of the times, but of course, there's much room for improvement as everywhere.
Yeah, thank you. So a solution could be to have a separate panel, to have also representatives from these ministries on board, right? I would suggest this. So we had another question from the audience, and I think you were first, please. Please also address to whom you would like to ask this question from the panelists, please.
Good morning. Yes, I think everyone can answer the question. Okay. My name is Flora. I'm a senior lecturer at Oulu University Hospital, Oulu University of Applied Sciences in Northern Finland. And thank you so much for your very substantive presentation, very inspiring. You have been talking a lot about multidisciplinary team and the involvement of multidisciplinary team and local stakeholders in capacity building research. And 50% of the healthcare workers, member of the healthcare team, are nurses, and nurses are always left behind in decision and policy-making process. And they have been doing a lot of research, translational research, empirical research for many years, and even educated themselves as high as PhD in nursing, PhD in public health. But what do you think are the factors that hinder academias and management and even policy and decision makers to involve nurses in the decision-making process? Anyone can answer.
You said we'll be able to answer, but I think this is very complex.
Because I'm still wondering, like, we want to involve ourselves. We are for patient safety, for patient-delivered care, but we are not around in the decision-making table.
Okay.
In research.
Right, but maybe this is another good point. So not everyone needs to get a PhD. You can understand research, and goes back to my original point. If, let's say, many masters in public health, if they have a focus on research or evidence and its use as part of it, they have to be agnostic to the background of the person who applies. Hence, a nurse can also apply. Well, the number is there, but very small, right? So that number could definitely already allow for, because if I was to say, okay, let's have, special program, that it's more complex. But I think if we start small, probably one of the immediate kind of answers for me to you would be that you don't need to become an academic researcher to have background in evidence or understanding of evidence and go back and work in the decision-making process. So that was your question, decision-making process. So for that, I think some of the master's level evidence-focused research user type of training would be most appropriate, and not only for nurses, but for dentists, for doctors, for other health professionals who are out there. And I guess this is also a question for next year when you have this panel. It's not only funders, we'll have to have the actual ministry or people who are in decision-making positions. And then maybe we could ask this question. Does it matter who gives you advice, a nurse with a master's in public health or a doctor with a master's in public health? In theory, should not matter.
Yeah, thank you. That was a very good statement, I think, and answered also some of the questions. So we have now 6 minutes to go and we have to be on time. So we have 1, 2, 3 questions. So I will only be able to take now very short, please your question very shortly and to whom you want to ask this question and a quick answer if possible. Yeah.
Okay, I'll do my best to speak now. So my name is Wahdat. I just came from Afghanistan. I'm working with UNICEF.
People in cannot, yeah.
Good morning, ladies and gentlemen. My name is Wahdat. I came from Afghanistan. I'm working with UNICEF Afghanistan in as a subnational nutrition cluster coordinator. So basically, my question will be about we have talked about the gender. I mean, gender capacity building of local staff or local authorities. But the situation in some countries, especially, I'll be addressing the issue in Afghanistan. So currently, the country is controlled by a de facto authority, the people who came by force. So building the capacity of the local authority, it will be a question. Sometimes it is, we have seen some donation from some donors, but they have their own conditions and their own terms. So sometimes we are not able to consider like donor conditions, but we are following the donor condition, but sometimes it is creating a barrier for us to not address the real situation in Afghanistan. And the other part of my question is about like how can we provide better opportunities for female, especially in Afghanistan. Currently, the de facto authority, they banned the schools. So currently the schools are closed, but we have some potential female staff who can if we pave the way for them, they can be a good researcher in the future for better decision making. Over.
Well, I think this is a very complex question, of course. And so, I mean, I'm not sure whether we need more. Is there a quick answer to that? I don't know.
Maybe not a quick answer, but this also demonstrates that this paradigm of pandemic and not pandemic, you see, you have a situation where it's not a pandemic issue, it's a whole other issue, but it affects the capacity and future, and it impedes on, in 10 years, you probably won't have as many health workers because they're not going to school, and eventually they're not going to be trained to become researchers or decision makers. So we have to remember, this just reminds us that this is not something we have to kind of do and then stop and do and then stop. So this is a long-term commitment for this has to come. I'm not answering specific question in Afghanistan. I'm just using your question to demonstrate how complex the world is when it comes to capacity building, and it goes beyond pandemics.
Yeah, I think with this, we really have to wrap up. I encourage every one of you who still has questions to come up after the panel. Our panelists will still be here because we need to wrap up. And I would like to hand over to Mieczek for a quick wrap up of this really intriguing session.
Thank you very much. It's actually on days like these that I get convinced why an animal scientist like me has to be part of the German Alliance for Global Health. It's on days like this when the discussion goes beyond one discipline and we look at the issues from a multidisciplinary point of view and also agree that there's no one bullet that would solve these problems, but we can do all these together. It is on days like this when we run out of time because we still have issues to discuss that I get convinced that we all can contribute to coming up with solutions to the problems we have. Thank you very much to our panelists for your time and for your insights. Thank you very much to Gloria for giving us the opportunity to co-chair this session and to have this session. Thank you to Clarissa, my co-chair, for all the insights and guidance she gave as a co-chair. Thank you. And above all, thank you to all of you for coming to this session and also for contributing with all that discussion. With that, I would like to pass on to you to go to another session.
But he's leading a research.
So thank you very much, and wishing you a very good summit. Thank you.